Bismillahirrahmanirrahim. I am Dr. Ashta Arif, working as Associate Professor of Gynae. History taking in obstetrics is very, very important, whether it is an undergraduate exam or postgraduate exam. Um, History taking is an essential part of every exam. So every student must know how to take history of an obstetrical patient. So the first part is we will ask the biodata, which will include the name, husband name, her age, and the postal address. Then we will ask about gravidity, parity, and the miscarriage. So everyone must be familiar with these terms. Gravida means that number of times she has conceived, and para mean that number of pregnancies that were delivered after the age of viability. And what's the age of viability? It is 24 weeks of pregnancy. And miscarriage, this term will be used when pregnancy loss occurs before the age of viability, that is before 24 weeks of pregnancy. Then you will ask about her LMP. LMP is the first day of the last menstrual period, and then you will calculate the expected date of delivery. I have made a video how we will calculate the expected date of delivery, and I will give the link in description. Then you will ask about the mode of admission, whether she was admitted through emergency or through OPD, and what was the date of admission, what was the indication of admission. After this, you will calculate the duration of pregnancy, and you will take the history of present pregnancy. In any other patient, like in medical ward or in surgical ward, here we say that we will take the history of the presenting complaint. But the pregnant patient, pregnant lady is not a patient. She is our client. And here we will take the history of the present pregnancy, not the presenting complaint. If she has any other complaint other than pregnancy, then we will take the detailed history of that complaint also. But first, we will take the history of present pregnancy. And the pregnancy is divided into 3 trimesters. Total, there is 9 months. So we will divide the whole pregnancy into 3 trimesters. First trimester will include first 3 months, and the second trimester will include fourth, fifth, and the sixth month. And the third trimester will include seventh, eighth, and the ninth month of pregnancy. So the first question we will ask from the lady, that whether it was a spontaneous pregnancy or she conceived after treatment, and how she confirmed her pregnancy. She assumed by missing periods, or it was confirmed by urine pregnancy test, and later on by ultrasound or not. Did she booked herself, and where she has booked herself, with the doctor, with the midwife, with the specialist, that is gynecologist, and has she taken the folic acid? Is there any history of fever, flu-like illness, or rash? Is there any history of vaginal bleeding or vaginal discharge during the pregnancy? And her dating scan was done or not? And her investigations, baseline investigations that include complete blood count, random blood sugar, and viral markers that include hepatitis B, surface antigen, anti-HCV antibodies, and HIV, and what is her blood group. So these investigations were done or not. And then the questions related to the second trimester are that when she perceived the fetal movements, her anomaly scan was done or not. Routinely, we do the anomaly scan at 20 weeks of pregnancy. Is there any history of high blood pressure, diabetes during the pregnancy? Has she received the tetanus vaccination? And her tummy size is growing according to the pregnancy or not? And fetal movements are okay or not? Are there any concerns regarding the growth of the baby or any other concerns during the pregnancy? And is there any history of bleeding, leaking, or vaginal discharge during the third trimester? So this is the history of the present pregnancy. And while asking these questions, you will keep in mind first trimester, second trimester, and the third trimester. Then you will ask about the systemic inquiry. Like any other history, you will ask about her bowel habits, sleep, and appetite. And then you will take the detailed obstetrical history. Um, has she ever been pregnant before? Is there any history of antepartum, intrapartum, and postpartum complications? In antepartum, you will ask the history of hypertension, diabetes, or any concerns about the growth of the baby. And intrapartum, you can ask about the delivery complications, any prolonged labor, or any other concern. And postpartum, you can ask the history of the postpartum hemorrhage or any other history like DVT or postpartum depression. Then mode of delivery is very, very important. Whether she was delivered by spontaneous vaginal delivery or by cesarean section, and if she was delivered by cesarean section, then you will ask the details of the cesarean section so that you can decide the mode of delivery in this pregnancy. And you will ask about the indication of cesarean section, at what gestation it was done, any history of wound complications, wound infection, and if the notes of the previous cesarean section are available, then you will review the notes. Okay, then you will ask about the details of the baby, whether the baby was born alive or dead, and what was the weight of the baby was breastfed or not, baby was vaccinated or not, and how is the baby now. Okay, so this is the detailed obstetrical history you will ask from every obstetrical patient. Then after obstetrical history, you will ask about the gynecological history, what was the age of menarche, regularity of the cycle, any history of painful periods, painful coitus, any history of intermenstrual bleeding, postcoital bleeding, has she ever used contraception, and her pap smear has been taken or not. Then you will take the medical history, past medical history, any history of high blood pressure, diabetes, asthma, tuberculosis, or any other chronic illness in the past, and what is her blood group, and any history of blood transfusion in the past. Then you will ask about the surgical history, any history of surgery on tummy or down below, okay, or any other surgery in the past. Then after the medical and the surgical history, you will ask about the drug history and the drug allergy. Is she taking any regular medications or any history of drug allergy? Then family history is very, very important in every obstetrical patient. You will ask about the family history of hypertension, diabetes, deep venous thrombosis, or any genetic disease that runs in the family like thalassemia or any history of anomalous babies in the family. Then mental history is also very important, and you will ask about her mood. Is she taking any antidepressants or antipsychotic drugs? Then you will take the social history. Social history always, always ask from the woman after signposting. लाइक माजरत के साथ मैं आपसे कुछ ज़ाती सवाल करना चाहूँगी कि क्या आप सिगरेट नोशी या तंबाकू नोशी तो नहीं करती, या कोई और नशावर चीज़ तो इस्तेमाल नहीं करती? ठीक है, तो उसे पहले साइन पोस्ट करेंगे, देन यू विल आस्क अबाउट द these things, otherwise she will mind. And then you will ask about what she do for her living, and any safety concerns, and how is the support at home. Okay, and at the end you will thank you for you will say that thank you for sharing these information. Do you want to add anything else? In this way you will take the history from the obstetrical patient. Like if there is a patient who is primary gravida and she has been admitted through OPD for elective cesarean section due to breech presentation, how you will summarize your history? You will tell that my patient, Asia, wife of Ahmed, 25 years of age, resident of Multan, primary gravida. Her last menstrual period is this, and expected date of, according to this, expected date of delivery is this. She was admitted to outpatient department on 15th of March for elective cesarean section due to breech presentation. And she conceived this pregnancy spontaneously, and pregnancy was assumed by missing periods. Later on, it was confirmed by urine pregnancy test and ultrasound. She booked herself with a local doctor. During the first trimester, she took folic acid. There is no history of fever, flu-like illness or rash, and there is no history of vaginal bleeding or vaginal discharge. And during the second month of pregnancy, her blood tests were done, and according to the woman, the reports were okay. And her blood group is B positive. She perceived fetal movement for the first time during the 5th month of pregnancy, by the end of 5th month of pregnancy. And her anomaly scan was done at 20 weeks and it was normal. There is no history of high blood pressure, diabetes, and tetanus vaccination was done during the 6th and the 7th month of pregnancy. And according to her tummy size is growing according to the pregnancy. And by now, fetal movements are okay. And there are no concerns of growth and or any other concern. And there is no history of vaginal bleeding or vaginal discharge. And one day back, her ultrasound was done, and she was told that baby is in breech position, and she has been admitted at 38 weeks of pregnancy for elective cesarean section due to breech presentation. Okay. Then you will tell about the systemic inquiry that her bowel habits are normal and her sleep and appetite is good. In obstetrical history, you will tell that she is she is primi gravida, and then you will tell the gynecological history that her age of menarche was 14 years and her cycle was regular of 5 by 28 days with average blood flow. There is no history of dysmenorrhea, dyspareunia, intermenstrual or postcoital bleeding. She has never used contraception and her pap smear has never been taken. And there is no past history of hypertension, diabetes, asthma, tuberculosis in herself or in her family. And there is no past history of blood transfusion, and she has no previous history of surgery on her tummy or down below. And she is not taking any medicine, or there is no history of drug allergy, and there is no family history of hypertension, diabetes, or deep venous thrombosis, and there is no family history of anomalous babies. And then she is a housewife, and she lives with her husband, and she has a good support at home. Okay, in this way you will present your history. So hopefully this video will be very helpful for many students. If you have any question, you can post in the comment section. Thank you very much.